Hello everyone. Today I'm going to discuss three important questions from three different topics which are important for your NEET exam. Remember students, you may read the theory thoroughly up to 100%, but it is the MCQs part which give you an edge to crack the NEET exam. You have to practice number of MCQs. Yes, I'm discussing three MCQs for today's topic, but these three topics, the three questions I'm going to discuss cover you multiple questions. Okay, in that way I'm going to discuss. The first question I'm going to discuss is from the topic endocrine system. Okay, endocrine system, that is your class 11 chapter. Okay, class 11 chapter, the chemical control and coordination. Okay, from that. Now let's see the question. The question is match the following column and select the correct option. Now this question is from NEET 2020. Okay, under column 1 you have different endocrine glands, under column 2 the particular diseases. Okay, so whatever may be the endocrine gland, you always remember one thing. So any endocrine gland, now it produces the chemical messengers. Now these are called as the hormones. Okay, so whenever these are overproduced or underproduced, it results in the disease. Okay, now normally we have the nervous system which is fast and short-lived, which takes care of our body, but we need a continuous system which coordinates various functions of the body. That function is done by our endocrine system. Okay, so that is why the hormones are very important, because they reach various targets. They can reach each and every cell of the body. Okay, now let's see the diseases in the column 2 so that we can match with the particular gland. Okay, now the first disease mentioned here is the Graves' disease. Now the Graves' disease is always produced by increased thyroid hormones. That is the hyperthyroidism. Whenever there is overproduction of thyroid hormone, it results in Graves' disease. So it is whenever thyroid gland is affected, you have the Graves' disease. Okay, so B, it is one. And diabetes mellitus, this is caused by the underproduction of the insulin hormone. Now, which is whenever the pancreas are affected. So D, it is 2. And the diabetes insipidus, it is produced by the underproduction of the antidiuretic hormone, which is produced by the pituitary gland. So for A, the option 3 is correct. And the last one, the Addison's disease. The Addison disease results whenever the adrenal glands are affected, because here you see the underproduction of the hormones glucocorticoids and the aldosterone Okay, so if we see the option C, it is 4. Okay, now if we see in the options, now the first set it was mentioned 1 as 4, that is A as 4. So the first set is wrong. And the second set, A is 3, but B is 2. That is wrong because B is 1. So even second set is wrong. The third set mentioned here is the correct option. Okay, the third option 3 is the correct one. And option 4 is again wrong, because option 4 it was mentioned A as 2. So wrong. Okay, now I'll discuss in detail why these diseases are caused by these damage to the particular endocrine glands. Okay, the first one I'm going to discuss today is the diabetes insipidus, which is caused by the decreased antidiuretic hormone. Now, any of your aunt or uncles, normally they may complain, we are passing urine many times, okay, and but still our blood glucose levels are normal. But in diabetes, we should have high blood glucose levels. Why it is not happening? This is the patients with diabetes insipidus. Okay, they have normal blood glucose levels, but they have huge water loss. So they drink more and more water, that is called polyuria, and they pass more urine. Okay, so they drink more and more water as they are more thirsty. That is called as polydipsia. Now, why do you see these symptoms? Why do they have more water loss? Why do they pass more urine? They pass almost dilute urine, which is 3 liters per day. Okay, why are they passing so much of urine? It is because the antidiuretic hormone, which is produced by the pituitary gland. Now, your pituitary gland is present in the brain. Okay, the pituitary had 2 parts. It has had the anterior part and the posterior part. The posterior part produces the antidiuretic hormone. The antidiuretic hormone shows effect on the kidneys. Now, your kidneys have the functional unit called as the nephrons. Okay, now what is the function of this antidiuretic hormone? The function of this antidiuretic hormone, it reabsorbs the water normally from the distal tubules. Okay, that is the function of the antidiuretic hormone. As a result, what happens? It decreases the water loss. Now, what is the water loss? It is called diuresis, antidiuretic hormone. What is the name of this hormone? It is antidiuretic. That is, it reduces the water loss. But what is happening whenever there is a damage to the pituitary gland? That condition is called as the neurogenic diabetes insipidus. or there is a damage to the nephrons of your kidney, that condition is called as the nephrogenic diabetes insipidus. So whatever may be the scenario, what happens here? Your antidiuretic hormone is underproduced. So what happens? Now this water absorption is not taking place. So what happens? More urine is passed. Okay. So that's why the patients have the polydipsia and polyuria. So this condition resulting because of the damage to the pituitary gland. Now the next disease we are going to discuss is about the Graves' disease. Now, the Graves' disease is an autoimmune disorder which you see more in the females. Okay, this is seen in the more in the females. So, what happens here? The thyroid gland is enlarged. It is autoimmune disorder where the hyperthyroidism, as the thyroid gland is enlarged, here you see more and more thyroid hormones. That condition is called hyperthyroidism. Okay. Now, what happens? Normally, the pituitary gland, it releases the thyroid stimulating hormone which stimulates this thyroid gland. Now this overstimulates, as a result. What happens? The thyroid gland, you see, it overacts, that is why it is called enlarged. It is more increased in the size. Okay, it is increased in the size, as a result it releases more of the thyroid hormones. What are the thyroid hormones? They are the T3 and T4, that is the triiodothyronine and the tetraiodothyronine. Okay, so this is also called as the thyroxine. Now what is the function of this thyroid hormones? Normally they take care of the basic metabolic rate and the sympathetic activity of your body. But what is happening here in the Graves' disease? You see the goiter. Here. Okay, so what is happening here? This basic metabolic rate is excess happening. It is over reactivity. And the sympathetic activity is increased as well. The patients have rapid heartbeat, they have irritability, anxiety, and exophthalmos. That is, you see the protruded eyes. Okay, this is all because the thyroid hormones are overproduced, and that condition is called hyperthyroidism. So here in Graves' disease, what is happening? The thyroid gland is affected. Okay, now the next condition is about the diabetes mellitus. Okay, now the diabetes mellitus, I already said to you here, these people have high blood glucose. What do they have? They have the high blood sugar levels. Now, why do they have the high blood sugar levels? What is not functioning here? Here, your insulin. Okay, your insulin is underproduced or it is not at all produced. What is the function of the insulin hormone? Now, normally if you see the pancreas, they have the islets of Langerhans have two cells, that is the alpha cells and the beta cells. The alpha cells produce the glucagon hormone and the beta cells produce your insulin hormone. Okay, notice that normally your liver, okay, your liver produces the glucose, which reaches your blood vessels, okay, which is in your blood. Now this, whenever the glucagon hormone stimulates, your liver produces, okay, so the blood glucose levels are high. Now this insulin, what it says, it always says, oh my dear liver, don't produce so much, okay. It gives a negative feedback on the liver to not to produce, and it always says your cells to uptake this glucose which is here. Okay, it instructs the cells to take the glucose. Now this is underproduced in diabetes mellitus. So what is happening? The glucose is staying within the blood, so the high glucose levels are seen. Okay, so that can be of type 1 or type 2, where in type 1 this is insulin dependent diabetes, and in type 2 this is insulin resistant diabetes. So whatever may be the condition, the patients have high blood glucose levels and they have polydipsia, they have more thirsty, they have polyphagia and polyuria, that is they pass more urine. As they have more water loss, they take more water. So this is about the diabetes mellitus, which you see whenever there is any damage to the pancreas. Okay, so that's why these people, they take the insulin hormone artificially, some people. Okay, now next disease which we are going to discuss about the Addison's disease. Now when do you see this Addison's disease? Okay, the Addison's disease is seen whenever there is damage to this adrenal glands. Now the adrenal glands are also called as the suprarenal glands. Why? Because you see them above your kidneys. Okay, now these adrenal glands, they are triangular glands which have the outer cortex, which is called as the adrenal cortex, and the inner one is called as the adrenal medulla. The medulla releases the catecholamines. Okay, it releases the catecholamines, and the outer cortex, it releases the corticosteroids. Now this adrenal cortex, okay, it releases these corticosteroids. What are they? The glucocorticoids and the aldosterone. Now the glucocorticoids, okay, what is the function of these glucocorticoids? You see in the name itself, they have effect on the carbohydrate metabolism. Now what is happening here? Any damage to your cortex might happen. So these hormones are underproduced. So your glucocorticoid is underproduced. So carbohydrate metabolism is affected. So what happens? There is hypoglycemia. That is your blood glucose levels is decreased. Okay. And your aldosterone is underproduced. So what happens? Here is hyposecretion. So what happens now? These patients have weight loss, weakness, and the most important feature, pigmentation of skin is seen, and fatigue. Okay. So this is about the Addison's disease, which you see whenever there is a damage to the adrenal gland. Okay. And the next question we are going to discuss is from the animal kingdom. Okay. The animal kingdom. And the question here, this question is from the 2019, and the question is from animal kingdom. Now you see, students, okay, various animals are classified into different groups. Okay, they are classified into different groups based on some common features. Now this question is about such common features. Now let's see the question. The first question, the question is A, organ system level of organization. B, bilateral symmetry. C, true coelomates with segmentation of body. Now select the correct option of animal groups which possess all the above characters. So the question is asking now which animal has all the organ system level of organization, bilateral symmetry, and true coelomates. If you see the answer options, the options are, the first option is Annelida, Mollusca, and Chordata. My dear students, mollusks do not have segmentation. So option 1 is wrong. And if you see Annelida, Arthropoda, and Chordata, now these three phylums, okay, they have all these features. So option 2 is correct. In option 3, Annelida, Arthropoda, and Mollusca, again, Mollusca do not have segmentation. So option 3 is wrong. Option 4, I said you, mollusks do not have. So option 4 is also wrong. The answer to this question is option 2, Annelida, and Arthropoda, and Chordata. Let me explain in bit, okay? Now, if you see the annelids, okay, what is the most significant feature you see in the annelids? Okay, the significant feature you see in the annelids is that they have these ring-like structures. You see the earthworm, okay? So they have the segmentation of the body, which you don't have in this mollusks. That is why the mollusks, they don't have the segmentation. You see the snail, isn't it? You don't see the segmentation. That is why the mollusk is not the correct answer. Okay. Now, if you see in the annelids, they have organ system of level of organization. Arthropods, you have cockroaches. Okay. You have organ system level of organization. Mollusks and chordata all have organ system level of organization. And bilateral symmetry is seen in all the groups. Okay. That is when you have cut the body into half, two equal halves, you get it. And true coelomates, all of them have true body cavities. But segmentation is seen only in annelids, arthropods, and chordates. Okay. Now, the chordates, they have the vertebral, the notochord. That is why the chordates, they are called as chordata. Okay, because of the presence of the notochord. Okay. Now, so as they do not have the segmentation, now this odd man out is the mollusk. Okay. Now let's dive to the next question. The next question is from the health and disease. Okay. Health and disease is a very important topic. Okay, because you get frequently questions from the bacterial and viral diseases. The question I'm going to discuss is, which of the following sets of diseases is caused by bacteria? Now, see, the question is from bacterial diseases. If you see the options, option 1 is cholera and tetanus. And my dear students, cholera, it is a bacterial disease, and tetanus is a bacterial disease. Okay. Now, the tetanus is also referred to as the lockjaw disease. Okay. And the cholera, it is caused by the bacterium Vibrio cholerae. Okay, now these two are bacterial diseases, so you can go for option 1. Option 2, typhoid, it is a bacterial disease, whereas smallpox is a viral disease. Option 3, tetanus, it's a bacterial disease, but mumps is a viral disease. And option D, herpes is viral, and option influenza is viral. So these three options are wrong. So the option 1 is correct answer. Okay, now you're getting confused how to remember this bacterial and viral diseases. Here's my trick for remember those diseases. Okay, now let's go for the trick. Okay. You are fond of potato chips, isn't it? So the trick for you is McDonald gave 2 potato chips. Okay, so remember this because you like potato chips. So you can remember these bacterial diseases also with this tip. Okay, so M for meningitis, D for diphtheria, L for leprosy, D for diarrheal diseases, and G for gonorrhea, T for tetanus, W for whooping cough, and P for pneumonia, T for tuberculosis, T for typhoid, and C for cholera, and S for SIPS. So this is the important trick to remember the bacterial diseases. And the next tip for the viral diseases. Okay. Now, because of this corona pandemic, everyone are affected, right? So students are missing going to theaters. So here my trick is, corona stole my HD personal camera. As you're not going to movies, that's why I said this trick. Okay. Now, the viral disease trick is this. C for common cold, that is rhino, coronavirus, whatever may the virus. Okay. Smallpox and SARS for S, and M for measles or rubella, and H for herpes and hepatitis, and D for dengue, and P for polio, C for chickenpox, A for AIDS, M for mumps, E for influenza, and R for rabies. E, make it as I, okay? So there's a trick for the viral disease. So with this trick, I hope you can clearly make out this bacterial and viral disease. Students, please prepare properly for your exam and stay tuned with me so that I'll give you good tips and tricks to crack the NEET exam. Thank you.